Hello, my name is Aaron Adams, and I'm a PhD student in the Department of Geography at UConn. In this short paper, we sought to evaluate COVID-19 dashboards published by United States state governments for cartographic errors. In this video, we will be focusing on the biggest issue we looked at, normalization of data in choropleths. A dashboard in this context is a type of web map that displays multiple visualizations to allow users to make decisions and see trends in the data. Here, we have the UConn Geography Department dashboard that shows a variety of information, including cases, deaths, and vaccine coverage. Dashboards are very easy to create, and thus users with little cartographic training are making and distributing them. Unsurprisingly, the maps on these dashboards often do not follow established cartographic conventions. Perhaps the most important of these conventions that is often ignored is the need to map normalized rather than absolute data in choropleth maps. Normalization means mapping the case rate by considering the population of a state, instead of only mapping the total cases in a state. The reason for this is demonstrated by the figure. Map A shows the total cases of COVID-19, and unsurprisingly, states with larger populations like California and Texas have more overall COVID-19 cases. Map B shows COVID-19 cases per 100,000. This controls for the difference in population between states, allowing for better comparison. Using a map like Map A may mislead users about the extent and impact of the pandemic. For instance, Arkansas, with the highest rate, is only unveiled in the normalized map. Normalizing data is an elementary and essential step to make a choropleth map. To determine how widespread this problem is, we evaluated the official dashboards of all 50 states on February 11, 2021. The results of this can be seen on the map to the right. We found that all states had a dashboard, and 47 states employed choropleth maps somewhere on them. Of these, only 16 employed some form of normalization, while 32 states improperly mapped totals somewhere on their dashboard. This means that 64% of states on February 11th were publishing potentially misleading COVID-19 maps. Future research will try to determine the impact this had on public perception of COVID-19.